Good afternoon and welcome to the Midday News. Here's what we have in the bulletin. Nurses at several hospitals stayed sick. Hospitalizations from COVID-19 hit a new record in the last 24 hours. And later in sports, double Olympic sprint champion believes she can lower the world record of 10.49 seconds. I'm Anthony Lugg. Here are the details. We begin with news that nurses at several hospitals across the island have been calling in sick as the health sector continues to grapple with a surge in COVID-19 cases. It's reported that the nurses are upset because of comments made by Prime Minister Andrew Holness. Cody and Barrett reports.
The lockdown has just been lifted and hospitals across the island are operating without some nurses this morning. Acting Regional Director for the Western Regional Health Authority, St. Andrade Sinclair, says while he's not of the view that they did not turn up because of the comment, he has been receiving reports.
I'm just getting information that a couple of the nurses have called in this morning sick, about 40 at Cornwall Regional up to the time, and I'm seeing some report from St. Anne's Regional Hospital to my other colleague that she's getting reports of nurses calling in sick as well.
While he still has not received any feedback from Falmouth and Savannah Lamar, he says some clinics and health centers are still operating at normal levels.
Noel Holmes, it's sputtering. It's not that significant either. The RN of the 3127 came in, and at the rest of numbers for the rest of people look normal. So it looks like it's just in St. James, where you have Cornwall Regional, the major regional hospital that has been significantly affected so far.
In the meantime, Regional Director of the Southern Regional Health Authority, Michael Bent, says the Mandeville Regional Hospital is the worst affected by the nurse sick-out of the 5 hospitals in the region. According to Mr. Bent, out of a complement of 91 nurses, only 38 turned up for the 7 to 3 shift at the Mandeville Hospital. At Percy Junior Hospital, 24 of 35 nurses, while at Black River Hospital in St. Elizabeth, the majority of nurses are at work. 34 of 36 signed in for duty, and over in Clarendon at the Mapen Hospital, 30 of the 47 nurses turned up, while the full complement of 19 nurses reported for duty at the Lionel Town Hospital. 60% of nursing staff at the Princess Margaret Hospital in St. Thomas have called in sick. The management of some hospitals are in meetings trying to decide the best way forward, while others say it's still too early to determine whether their service will be affected. Cody and Barrett, TVJ News.
Hospitalizations due to COVID-19 have hit a new record. 664 people have been admitted with the respiratory virus. 61 are critically ill. Meanwhile, the total number of active cases is at 14,128. The island's COVID-19 positivity rate now stands at 44.4%, down from 48.7% recorded on Monday. The country recorded 367 new cases of the coronavirus from 1,033 tests. The total case count is 63,831, and the virus also claimed 14 more lives for the period August 21 to August 23, increasing the death toll to 1,431. And the rise in COVID-19 hospital admissions is causing challenges for some health facilities. Chairman of the St. Elizabeth Health Department, Sean Brissett, says the hospital in that parish is at capacity. He's concerned with the COVID figures for the parish of St. Elizabeth. To date, the parish has recorded over 2,700 cases of the virus.
You are seeing high double-digit figures, 50s, 100s, infection, and the infection rate is very high as well, 40-odd%. That is 4 plus in every 10 person tested would have been positive. The hospital as it stands and is bursting at its seams, and that is where it is reflected. As I tell you, as I speak now, the waiting area, that is the area where people normally sit, has to be turned into a ward.
Mr. Brissett says the Black River Hospital has a capacity for 23 COVID patients, and presently some 40 patients are at that facility with the virus. In the meantime, Jamaica's supply of the COVID-19 vaccine is slated to increase today. The shipment will be another batch of the AstraZeneca medicine. Chairman of the National Health Fund, Howard Mitchell, told our news center that monthly shipments of the COVID-19 vaccine are guaranteed until the first half of 2022.
We'll receive another 100,000 doses, I believe, next week, and thereafter 200,000 doses of Johnson & Johnson every month for the next 9 months. Lastly, on Thursday of this week, we anticipate receiving another 200,000 doses of AstraZeneca vaccine through the kind courtesy of the Canadian government. So it is safe to say that we should not be concerned about whether or not vaccine dosages will be available.
The Ministry of National Security is dismissing claims that prison inmates are being neglected in the national vaccination drive. Last week, the attorney representing incarcerated DJ Vibes Cartel said his client, along with other prisoners, are vulnerable and are being left behind, noting that his client is willing to be vaccinated. But the minister without portfolio in the Ministry of National Security, Matthew Samuda, is reporting otherwise.
It is not true that we have not offered the person. I'm happy to hear of his willingness. I am aware that the vaccine was indeed offered to all inmates and indeed correctional officers on May 3rd, I believe it was, at the St. Catherine Adult Correctional Facility while he was still an inmate at that facility. So my hope is that when we do get to our next phase or our next round of vaccination at the facility currently being housed, that he will indeed take up the opportunity there.
Vaccination in correctional facilities started April 30. Mr. Samuda disclosed there will be another vaccination drive this Thursday at the Tower Street Adult Correctional Center, but he laments 90% of inmates are vaccine hesitant so far.
COVID-19 by way of the AstraZeneca vaccine. So all prisoners, we have had vaccination sessions at each of our adult correctional facilities. We've had approximately 10% take-up. Coming this Thursday, we actually have yet another session at the Tower Street Adult Correctional, which is our largest facility, and we continue to move around, engaging with the parish health authorities to ensure that we're able to offer the service as per standard.
It's time now for a break. Stay with us. More stories when we return. Welcome back to Midday News, and thanks for staying with us. On the verge of a crisis, that warning from opposition member Philip Paulwell, who says the country could see a social uprising if the government doesn't address urgently issues affecting the poor. He was speaking at a political conference in South Central St. Catherine on the weekend. Cody and Barrett reports.
We have to find a way to get some food into people's cupboard. Some people don't have a cupboard.
That urging from opposition member Philip Paulwell, as he warned that the cost of living is becoming almost unbearable and may plunge the country into social unrest. He stressed that the government has the power to help those who are suffering most, but says it has been grossly mismanaging the country's finances.
So you can't be boasting about a surplus and people out there starving. You can't be talking about 3 million to MPs. When I calculate 3 million to MPs, about 1,000 packages. That is not going to assist, because one package, one care package, will last you about 2 or 3 days.
That $3 million for each member of parliament is part of an overall $189 million COVID package the finance minister recently announced to help poorer Jamaicans cope with the recently imposed 7 days of lockdown. But Mr. Paulwell says it's not enough in light of the increasing cost of food.
Some of you don't have car, but you have to spend on fuel. You know why? Because everything requires energy. When you go and buy a soda, it is in a refrigerator. Electricity price is going up. When you take the bus, you the man will clamor and say that the 15% is not enough. Right? The price of fuel has gone up by more than 50% in the last year.
He's also concerned about the ever-rising cost of fuel.
When you look at the price of chicken, when you look at soap, when you look at rice, you see NCB put out about bread from $100 to almost $500. You know? When you see all of that happening, any responsible government must recognize that you are approaching crisis.
Now, in June this year, the finance minister had conceded that the pandemic would worsen Jamaica's poverty rate, which had dipped to an estimated 11% in 2019, down from 12.6% in 2018, the lowest in 12 years. Cody Ann Barrett, TVJ News.
And it's time now for the Business Minute. Here's Cody Ann Barrett.
In business news, Barita Investments has passed resolutions for an additional public offer, APO, of shares to the public. The company's board approved the issue of up to 125 million ordinary shares as part of Barita's authorized capital for the APO. The APO price will be $80 per share. The offer will take place between September 3 and 21. Carib Cement Company Limited has formed a committee that is mandated to develop a dividend policy for the company to pay out dividends to shareholders. Shareholders will be asked to approve the policy in a vote once it's drafted. No timelines were specified. The cement maker has faced criticism in the past from shareholders who have cited the inequity of Caribbean Cement paying out monies to direct the parent company Trinidad Cement Limited through an operating lease arrangement, while minority owners got no returns via dividends. And that's it for the Business Minute. I'm Cody Ann Barrett.
And here's a preview of what's coming up in this evening's health report.
Coming up in this evening's health report, we look at booster shots.
A booster refers to a repeat of a vaccine having completed the primary series. So primary series for most of the vaccines right now is a 2-dose regimen, right? So Pfizer, for example, 21 or so days apart, that's 2 doses. That makes up your primary series. You've completed your vaccination series after it kicks in about 2 weeks after your second dose.
That's the health report in Primetime News at 7. And now for today's Healthy Living tip. 4 tips for surviving shots. Distract yourself while you're waiting. Concentrate on taking slow, deep breaths. Focus intently on something in the room and relax your arm.
Now for the top regional and international stories, here's O'Shane Masters.
In the region, Barbados could achieve its target of 40% vaccination of its population against the coronavirus COVID-19 pandemic by the end of September and maintain a 60% immune population by 2022. That's according to a senior official of the Pan American Health Organization. Barbados has received its third and final batch of 33,600 coronavirus AstraZeneca vaccines from the COVAX facility. A new report by the World Health Organization, WHO, has found that the vast majority of people with high blood pressure or hypertension live in low and middle income countries, such as in the Caribbean. The study, released on Wednesday, found that 82% of all people living with hypertension, estimated at 1 billion, live in low and middle income countries. The researchers found that the Dominican Republic, Jamaica and Paraguay for women, and Hungary, Paraguay and Poland for men had the highest rate of hypertension in the world in 2019. The World Health Organization says the number of new global cases now appears to be stable after increasing since mid-June. The WHO reported more than 4.5 million new cases and 68,000 new deaths worldwide last week, only a slight increase from the more than 4.4 million cases and 66,000 deaths reported the prior week. The cumulative global caseload now stands at more than 211 million, with the total death toll surpassing 4.4 million. And that's it for your top regional and international stories. I'm O'Shane Masters.
And we head now to a quick break. When we return, we'll have your Midday Sports Report. Renarda Brown is standing by.
Welcome back. It's now time for your Midday Sports. Now, double Olympic champion Elaine Thompson-Herro believes that with the right conditions, she could go below the world record of 10.49 seconds. After posting the joint second fastest time of 10.61 seconds to win gold at the Olympic Games, Thompson-Herro returned to run 10.54 seconds to win the Prefontaine Classic on Saturday in Oregon. But speaking ahead of her clash with Shelly-Ann Fraser-Pryce and Sharika Jackson at the Lausanne Diamond League meet on Thursday, the national record holder has talked up her chances of breaking the record held by American Florence Griffith Joyner.
Honestly, going to Prefontaine, there was no intention of breaking that world record. It was a normal work day for me, and I came out with a world lead and a PB after a tiring championship. So seeing that 10.54, definitely it is in my reach, but I wouldn't say it's not a target right now, but on the perfect day and the perfect weather, if I get that, I would definitely challenge it. But if it doesn't happen this season, hopefully, I'm pretty close. So there's more work to go to that target. But if it doesn't happen this season, I'm fine with the time that I got right now.
And just waiting around. Now, Jamaica Football Federation President Michael Ricketts says the local governing body is actively thinking of alternative ways to have their England-based players involved in their World Cup qualifying fixture in September. As it stands, European Club Association members are set to prevent their players from going to red list countries during September's international break unless quarantine exemptions can be made. The UK government states those returning to England from a country on their red list must quarantine for 10 full days in a managed quarantine hotel and take a coronavirus test on or before day 2 and on or before day 8 of quarantining. It means that EPL players Leon Bailey, Ethan Pinnock and Michael Antonio could miss the September 2 fixture away to Mexico with that country on the list. And though Jamaica is not listed, that could change in the coming weeks, leaving Ricketts and the JFF to consider their options.
We are hopeful that we could very well get some of these players to come to Jamaica to play, even if they can't make the trip to the red-listed countries, including Mexico and Costa Rica. But if we are numbered amongst the red-listed countries, then certainly we would have to look at the options of playing elsewhere.
Still on football, Jamaica suffered their second defeat in 3 games at the Caribbean Football Union Girls Under-14 Challenge Series in the Dominican Republic on Tuesday. The Jamaicans went down to Puerto Rico 3-1 in their Tier 1 game to be third in the group on 3 points. Jamaica had defeated Grenada 6-0 in their opening game, but lost their second match 2-0 to the home team. In other games, Haiti defeated the Dominican Republic 5-2 to top the group, with 1 round to go. In Tier 2, leaders Aruba made it 3 from 3 with an 8-0 drubbing of St. Kitts and Nevis, while the U.S. Virgin Islands clipped Curacao 3-2. The Jamaicans have a rest day today before playing Haiti on Thursday. Meanwhile, on the boys' side, Jamaica went down 1-0 to Puerto Rico to remain on 1 point from 2 games in Group B of Tier 1. And finally, Pakistan's head coach Misbah-ul-Haq has tested positive for COVID-19 inside the bubble established for the 2-test series against the West Indies, which ended on Tuesday at Sabina Park. The former Pakistan captain, who is said to be asymptomatic, was the only person within the bubble to have returned to positive PCR COVID-19 results, hence will not travel with the team later today to Lahore. Now, instead, he will complete a 10-day quarantine in Jamaica and must return 2 consecutive negative results in order to travel. Members of the Pakistan team will fly back home today after drawing their 2-test series 1-1 against the Windies following a 109-run win at Sabina Park on Tuesday. Yasir Shah and Naseem Shah will remain in the Caribbean as they will take part in the Caribbean Premier League in St. Kitts. And that's it for your Midday Sports. It's back to you, Anthony.
Thank you, Renardo. Elaine Thompson here says under the right conditions, she's ready. Your take.
Right conditions in Oregon, I felt. Right conditions in Tokyo, I felt. 10.54 in Oregon, 10.61 in Tokyo. Has to be perfect, but the record will go, but when?
All right, thank you very much, Renardo. And that's the Midday News. I'm Anthony Lugg. Join us at 7 for Primetime News. On behalf of the news, sports, and production teams, good afternoon.